Hi, my name's Dave McCoy and we're here today with Gary Borman, who is a very experienced naturopath. Gary, how long have you been in business?
I've been in private practice over 10 years, and in that time we've well and truly exceeded the magical 10,000 hours as they look forward to be called an expert. So
yep,
maybe I'm an expert, I don't know. They call it practice because you're still practicing.
So you've seen thousands of people with all sorts of conditions.
Yeah.
And today we're talking about arthritis. Now there's two main forms.
Yep.
Osteo and rheumatoid.
Yep. But
it's a very complex condition.
Certainly can be, and most people know of osteo and rheumatoid as the main ones. There are other forms, juvenile arthritis and arthritic conditions. Purely by definition, it is inflammation of the joints. Yep. So there can be lots of things that cause that. The big thing though, it's getting more and more common. We're seeing lots of people with joint pain. Part of that can be weight issues, but we are seeing lots of people that are constantly taking pain medications to try and manage this joint pain that's going on.
Okay, so traditionally, what's being used for arthritis?
Traditionally, there have been some herbs that have been quite successful in arthritis, but again, we're just talking analgesics. So painkillers, pain coverers,
yep.
Trying to repair and undo the actual cause has always been something that has eluded people.
Mm-hmm. Okay, so basically people have been, the only option has been to take painkillers, and of course every 8 hours or whatever it is, you've got to take another lot.
Well, some more than that too. Some people are taking every 4 hours, they're topping up their pain meds, and the more that you look into it, the less safe these pain medications are. All the classes of pain medication have their drawbacks. So your aspirin is well known to cause a lot of digestive bleeding if you take too much of it. The paracetamols or acetaminophen, depending on what you're watching, it belts up the liver. I've actually got it in a pharmacology book just sitting near us where they talk about the metabolites of paracetamol as being toxic to the liver. So obviously you don't want to go taking much of that. Ibuprofen similarly gives the kidneys a bit of a workover. Then we get up to a more serious class of drugs like your corticosteroids and even methotrexate, which was originally a cancer drug.
Yep.
Loaded with side effects, and people really do start to suffer when they're on these drugs long term.
Yep.
So it's not a viable option. What we need to find is something that fixes their pain.
Yep. So you've had something available now only in private consultation.
Yep.
Tell us about that product.
This is a unique blend using a bit of MSM, ironically, amongst a couple of other things. And what we've been finding is that within about 30 days, so between 28 and 32 is the most common window, most people are pain-free or very close to it. So their reliance on pain medications all but drops away. And when you look at people who've died from pain medication abuse, Prince, Michael Jackson are two names that readily come to mind. It's not selective on who's in pain, and it's also not selective of who can get addicted to these painkillers.
Okay. So the product that we've got here today, you take the first bottle, which is about 34 capsules.
Yep.
And between day 28, 34, significant pain relief, or even no pain at all.
Yep.
And we've done trials on this. Yep,
there have been some trials which we have run. And that's why we can say it's this 28 to 32, 34 day period. You tend to be quite slow or not noticing too much in your first few weeks.
Yep.
And that's probably because when you're using natural products, it takes a lot longer to actually get the whole ball rolling.
Okay.
But around that 30 odd day period, people are just going, wow, I don't need these pain drugs, or instead of taking 4 doses a day, I'm taking 1 dose a day.
Okay. And after 34 days or thereabouts, what happens after that period?
We're going down to a maintenance dose.
Yes.
And that is continuing to perform for people. We've had some that were still on low-level pain medication at the first 34 capsules. In the maintenance period, then they've gone totally off them. So they've been able to throw away their pain drugs and they stay pain-free.
Fantastic. So for 1 month, it's the super strength.
Then the rest,
And then after that, a maintenance dose?
That's it. And it's
fabulous.
Very well priced, considering what damage can be done through the synthetic products and what else is on the market.
Yep.
It's actually quite cheap per dose and very, very safe. When were investigating the product in design, we looked at a thing called LD50s. Now, LD stands for lethal dose.
Yes.
And this is one of the gold standards they use for how dangerous is a drug. So when we compared it up to the aspirins, ibuprofens, etc., we were finding it's about 40 times safer. So the LD50 is up here, whereas the other ones is down here. And these are drugs you can buy over the counter at pharmacy or even in supermarkets. So when we talk safety, extremely safe.
And these are all natural products? There's no artificial...
Nothing artificial at all.
Fabulous. So what people can do is go to www.painreliefarthritis. There's a web page there with further information, and from there you can go to another site which will allow you to purchase this product. So please, if you've got arthritis, there's frequently asked questions, all sorts of information. Go to the page, have a look, and then you can purchase the product from there.
That's right.
Thanks,
Literally
Gary.
nothing to lose.
Nothing to lose.
Yeah.
Fabulous. Thanks, Gary.